Welcome to the Bowringer Academy Parasite webinar series. In today's webinar, we'll be discussing monstrous mites. We'll start the webinar by looking at the problems that mites can cause. We'll then move on to the mite life cycle, and we'll finish by looking at the advice that we can give owners about how to control mites in their pet. So, what's the big deal about mites? The most common mites that we see in practice are Sarcoptes scabiei varcanis, Demodex canis, and Otodectes cynotis. And so these are the mites that we'll be discussing today. The mite Notoedras cati is occasionally seen in cats, but as this is uncommon, we won't be focusing on it in this webinar. So let's start with Sarcoptes scabiei. Sarcoptes mites are highly infectious and they cause a condition called sarcoptic mange. We see this condition most commonly in dogs. It can be seen in cats, but this is rare. The primary clinical sign that we see with sarcoptic mange is intense pruritus, i.e. intense itchiness. And when we examine the dog, we often see that they have reddened skin and hair loss. And because of the intense pruritus, it's not uncommon for them also to have self-inflicted trauma. The most common areas affected are the ears, the muzzle, the face, the elbows and the hocks. But in some pets, the whole body can be affected, as in this image on the left, and this can be particularly debilitating for the pet. Humans can also be affected by Sarcoptes. They have their own distinct Sarcoptes strain, but they're readily infested by Sarcoptes scabiei from domestic animals. In fact, the incidence of infestation from infested pets can be as high as 50%. Humans show similar signs to animals, so mainly it's intense pruritus. And the most commonly affected areas are the hands, the elbows and the knees. Demodex canis mites cause a condition called demodicosis, also known as demodectic mange. As with Sarcoptes, this is primarily a disease of dogs, and it's actually quite uncommon in cats. In dogs, it's been found that certain dog breeds are more likely to develop demodicosis, and these include the Staffordshire Bull Terrier, the Boxer, and also British and French Bulldogs. There are two forms of demodicosis, localised and generalised. In localised demodicosis, we usually see this in dogs younger than 6 months of age. The lesions are typically small, well-defined areas of hair loss, and there are usually less than 5 lesions on the pet. The most common area affected is the face, but we can also see lesions on the ears and feet. Unlike sarcoptic mange, the animals are usually non-pruritic, and lesions usually resolve spontaneously, typically within about 6 to 8 weeks. In generalised demodicosis, the entire body is affected by reddening of the skin and hair loss, and there can also be secondary bacterial infections as well. It usually presents as either a juvenile onset in dogs that are under 18 months of age, or adult onset. In adult onset demodicosis, it's usually associated with a concurrent immunosuppressive disease, such as Cushing's disease, hypothyroidism and neoplasia, or it can also be associated with immunosuppressive drugs such as corticosteroids. Otodectes cynotis primarily affects the ears, hence why we often call them ear mites. They can infest both cats and dogs, but cats are more commonly affected, and in fact in cats it's the most common cause of ear problems. Typically, infestations affect younger animals, but they can be seen in dogs and cats of all ages. Otodectes causes intense pruritus, and so animals typically present with head shaking or ear scratching, which can result in significant self-trauma. Occasionally, animals can also present with oral hematomas due to severe head shaking, and it's not uncommon for them also to develop secondary bacterial or yeast infections. So now let's look at the mite life cycle. Mites generally spend their whole life cycle on the host, with the exception of Sarcoptes, which can spend short periods of time, or can survive short periods of time off the host, typically on the bedding, collars, or on grooming equipment. The life cycle of most mites is 2 to 3 weeks, and during this period they develop from eggs to larvae to nymphs, and then finally to the adult mite. The Sarcoptes mite burrows into the skin, forming tunnels where they lay eggs, whereas the Demodex canis mite lives much deeper in the skin, in the hair follicles or sebaceous glands. It's important to note that small numbers of Demodex canis are found on the skin of most dogs, and this is considered to be normal. As I said earlier, Otodectes mites spend most of their life in the ear. However, they can leave the ear and cause skin irritation elsewhere on the body. The transmission of mites to other pets, or to humans in the case of Sarcoptes, usually occurs by close contact. So what advice can we give owners about how to control mites in their pet? So let's start with Sarcoptes. Sarcoptic mange should be treated with a suitable product, such as an isoxazoline licensed for the treatment of Sarcoptes scabiei. Repeated treatments are usually needed until clinical signs and skin scrapings show that the pet's condition has fully resolved. Because Sarcoptic mange is highly contagious, it's important that dogs that are affected are isolated from other dogs in the household. And as I mentioned earlier, because Sarcoptes can survive off the host for short periods of time, it's really important that we disinfect bedding, collars, and grooming equipment as well. When treating a dog for Sarcoptic mange, it's important to treat other dogs in the household as well, and this is to prevent recurrence. And lastly, it's important to warn owners that Sarcoptes is zoonotic, and so the mites can be transferred to them from their dog. So then moving on to Demodex canis treatment. Generalised demodicosis can be especially challenging to treat because of its persistent nature and its tendency to recur. It should be treated with a suitable product, such as an isoxazoline licensed for the treatment of Demodex canis, and treatment should be continued until the clinical signs have resolved and until 2 negative skin scrapes have been obtained 1 month apart. Following successful resolution of demodicosis, it's important to monitor the dogs closely and because of the risk of recurrence. And lastly, with generalised demodicosis, it's important to manage any underlying disease. And then on to Otodectes cynotis treatment. Several products are licensed for the treatment of ear mites, and these include topical treatments and systemic treatments, which come in the form of oral products or spot-on products. The benefit of eardrops is that they often treat other issues at the same time, such as secondary bacterial infections, but they can be difficult to apply in some pets. The benefit of systemic treatments is that they're often easier to administer than a course of eardrops. And they also treat those ear mites that have left the ear and are found elsewhere on the body. Otodectes eggs are resistant to treatment, and so it's important to continue treatment for at least one life cycle, which is 3 weeks for Otodectes cyanotis. An adjunctive treatment may also be required for secondary bacterial or yeast infections, and particularly if a systemic treatment has been used. So I hope you've enjoyed today's webinar on monstrous mites. If you'd like any further information about parasites, please visit the Bowringer Academy at www.bowringer-academy.co.uk.